I'm Coach Janine at Whole Body Health. Today I'm going to show you some soft tissue work you can do for your biceps femoris, which is actually your outer hamstring. I know you want to go here, bicep. No, it is your hamstring. So let's talk about where that is, since you do have a couple hamstrings. Where we're looking at today, the bicep femoris attaches up into your sit bone. So that bump that you feel when you palpate your butt or when you touch your butt, that is your sit bone. So it attaches there and it runs down through the middle of the leg to the outside of the leg, and it attaches down here at the knee. So that bicep femoris, the outer hamstring, is in charge of this movement, the flexion, bending the knee, bringing that heel up towards the butt. And it's also, because it's attached down here on your tibia, is also in charge of tibial external rotation, which you can't see my foot here, but this movement going out with the foot. So here's straight, there's external rotation from the tibia, from the lower leg. It also aids in that. So when that muscle is tight, not only is it keep you kind of in this bent position here, but it also keeps you in this externally rotated position at the foot, which is not what we want to see for proper movement. So when that muscle is overactive, just another thing about that, it can cause dysfunction not only at the ankle, but at the knee as well. So if you're somebody who has a lot of knee pain, this might be a good stretch for you, or a good release for you. So let's get started. We're going to use a softball today, and I've got a hard box, but if you don't have a hard box at home, maybe a chair that has a hard surface, maybe even your table, dining room table, be careful, don't mark it up. So where we're going to start, or where we're going to go with the ball, is we're going to put it on the outside edge here of the hamstring. And we're just going to work our way up while sitting on this box, all the way up into the back of the leg. So what we're going to look for are tender areas, commonly known as trigger points, and we're going to get those to release. So this takes a little bit of time. This is not very comfortable, but it does make a huge difference in the tissue tautness. So we want to start, I like to start down here at the bottom, box forward. It's a little awkward depending on the size of your box or your table, but you're going to put it, I'll start on this side, put it right underneath there. And you're going to sit up nice and tall and just apply some pressure there to that leg. Okay? If you don't feel anything right away, no problem. You might not have, that might not be an area of the bicep femoris that you need to address. So go ahead and move that ball up a little bit. Okay? That might be a spot there. You're going to hang out when you find that tender spot. You can apply more pressure by leaning forward. You can also relax that pressure a little bit by leaning back. That releases the amount of pressure you're using on that ball. Okay, you're going to hang out here 30 seconds to 2 minutes, depending on how fast it releases. Make sure that you're not tensing up. So we don't want to make the pain face and go, oh my God. That's not doing us any good. That's just tightening the area you're trying to get to relax. So you want to try to relax into it. Take deep breaths. Try to relax that muscle that you've got the ball underneath. If you can't do that, if it's just too painful, go ahead and take the ball out. Maybe start with something a little softer. You could use a tennis ball. Tennis ball is getting a little bit smaller as far as being able to hold it underneath there, but it does compress a little bit, so that way it's a little bit less pinpoint pressure on that area. So again, take whatever you're using. Lacrosse, you use a lacrosse ball, a tennis ball, a softball. I like the softball because it can really get in there over the broad area of the whole muscle. And you're going to work your way all the way to the back side. So I'm going to physically move the ball as I go. When I find a tender area, I'm going to hold it there, apply a little more pressure by leaning forward, leaning back to release that pressure. You can just kind of move in and out, especially if leaning forward applies so much pressure that it makes you want to grimace in pain. Don't go there. Just try to relax. And once you find a little bit of relaxation there, then you can move on to the next spot. A couple of areas of that, you've got a long area to work here, but a couple spots you definitely might want to look for is one towards the bottom edge in here as it comes into the tibia, and then also at the top edge. A lot of people will have issues with that area, that they get this pain up in their butt, right in that sit bone area. They can't figure out how to address it. Not saying it always comes from the bicep femoris, but that is a good spot to address. So you want to stick that right in that sit bone area. Sit on that there, apply that pressure. Again, you can go forward and backwards, just increasing and decreasing that pressure. 30 seconds to 2 minutes. Allow that area to relax, and then you can move on to the next. Once you've addressed the entire bicep femoris, you are done with that leg, and you can go over to the other leg. Have fun with it.